Evaluation and treatment, exertional heat illness, exertional heat stroke facts. So, EHS is 100% preventable if appropriately managed and recognized. It is considered the most severe heat illness, with 83% of fatal cases involving low physical fitness, sleep deprivation, training during the hottest hours of the day. And 100% of the fatal cases involve the following risks: physical effort was unmatched to physical fitness, and then absence of proper medical triage. So, the signs and symptoms for EHS include central nervous system dysfunction and then core body temp of greater than 105 degrees. And then exertional heat stroke treatment, we would want to remove excess clothing and equipment, take rectal thermometry, which is the gold standard, move to cold tub, begin cold water immersion, circulating that water, reassessing rectal temp every 5 to 10 minutes, cooling down the patient to 102 degrees, and calling EMS. Exhaustion signs and symptoms. It's the inability to effectively exercise in the heat, commonly due to cardiovascular insufficiency, some hypotension, energy depletion. Um, this is typically not as extreme with the CNS dysfunctions. So typically it's about just confusion, some fatigue. You could see a collapse and then low BP. And then that core body temp is lower than 104. So you'd want to remove excess clothing or equipment, move the patient to cool shaded environment, rehydrate them orally, cool patient with ice towels, monitor vitals, and then if the conditions are worse or beginning to worsen, contact ED for transport. And then conditions should begin to recover within 5 to 10 minutes, and then a full recovery in about 1 to 2 hours. So biggest differences are those core body temperatures and CNS functions. So the scenario is the third practice of preseason. It is currently 85 degrees outside, humid. Seen one of the linemen staggering and collapse. You rush over, he's conscious, he's combative and disoriented. So we're thinking that this is exertional heat stroke. So we would want to scan for scene safety, begin EAP for EHI, and then immediately assess patient's vitals. Remove the patient from the field immediately, and then have the patient covered appropriately to take rectal temp because EHS is suspected. And then we're cleaning that thermistor probe with alcohol wipes, and then lubricate the thermistor probe. Turn on that device, insert the flexible probe about 4 inches past the anal sphincter so we can get that core body temp. And then we're going to start the cold water immersion to the patient immediately.
So our athlete here has just collapsed on the field. I will be rushing over to the patient, checking our ABCs, just making sure that the patient is, their airway is clear, they're breathing, and they have circulation. So we're thinking they just collapsed. They might have exertional heat stroke. So we're going to uncover. We're going to take their shorts off. And then we're gonna ideally be covering them, so then we're just keeping some privacy and everything. We will take our rectal thermometer and we will clean our probe with an alcohol swab. Just making sure everything's clean and everything. We don't wanna be just putting something dirty into our patient. After it is all clean, we will get our lubricated jelly. And then we're just making sure that's on the probe so that it'll easily insert into the patient. Then we're going about 4 inches into the anal sphincter. There is a blue line indicated, so this can go inside. And once you get to that little blue line, you stop there. You're gonna turn on your device, wait for the rectal thermometer temp to pop up. And then we're transitioning to our patient to the cold water immersion. Before that is done, we are going to pull back the shorts up. we're going to tape the probe down so that it doesn't come up. And then we just have these shorts back up to keep their modesty and everything. And then throwing them in the tub, and we're checking this rectal thermometer about every 5 or so minutes to get an update on if the patient's core temp is going down.